Well, I keep coming to Ukraine because I love Ukraine. This is a beautiful country. People have a strong sense of identity, of culture, of history, of pride of their country, and of resiliency, and the determination to win this disaster and this war is palpable everywhere you go. So I believe, in addition to our role as physicians who provide training and provide medical support, we have a bigger role probably, which is in more assistance to Ukraine to overcome this war.
Hey Mike, welcome to Shashau.
Thank you. My first time going to Ukraine, and I'm happy to be joining the medical mission with MedGlobal.
I'm Dr. Michael Samatoka, board certified trauma surgeon, surgical critical care, and I work as a trauma surgeon and surgical ICU doctor in the United States. My parents are from Ukraine. So this current mission, we're in Lviv. We've got a group of 65 students, surgeons, who have come for training in trauma surgery and critical care. We also provide some surgical and medical supplies as part of our program. And MedGlobal, what we're trying to do is get everybody on the same level of training and experience, and provide the best care that we can for the Ukrainian people.
This is like World War I medicine. It's trench warfare. You're going across no man's land, but you've also got drones in the air around you. Evacuation times are long. The cases that I have seen in Ukraine are extremely challenging. The kind of problems they've got: infections, antibiotic resistance, the extremities, the bone loss, everything is very, very difficult. And if I can make a difference with that, that's why I like to come. We collect lots of medical equipment and bring it to Ukraine. And we bring boxes and boxes and boxes. And we often, most of the time, just pay for that out of our own pocket to bring the medical supplies to Ukraine.
We are expanding our programs, and we would like to stay in Ukraine after the war to help in the rebuilding of the healthcare system after the victory.
Our course covers all days of lecture in which we touch on the major topics in trauma surgery, mass casualties, properly triaging patients, the basics of trauma surgery care. And then the following day we go through an anatomy dissection using a pig model, and we basically go through the various organ injuries and what the best approaches are for treating those injuries and what the options are.
What I've noticed among Ukrainian doctors and surgeons and nurses, that they want to learn, and they are like a sponge. They absorb knowledge. Doctors and surgeons can weather the storm, can deal with the influx of trauma patients, or develop skills that are needed to deal with mass casualties and other issues.
Some surgeons come here to operate and help out with the operations, but I think if we can train surgeons to do a better job at dealing with these severe injuries, in the long run, that'll be a broader improvement in the care for the trauma patients.
A good group of people that we pull together every time to come teach this. And the students who come every day come with an idea that they want to learn as much as they can. Having picked up some new skills, some new ideas, and some link to an outside world that knows that they're here, they're working hard, and that we do care about them and what's happening here.
Our organization was one of the very first to put boots on the ground to assess the situation. We've set up several programs with trauma surgery, nursing training, psychiatric care.
We've trained more than 4,000 doctors and nurses and medics from 18 oblasts in Ukraine, from more than 100 different hospitals. And these trainings are quite diverse. And the purpose of these trainings is to provide resiliency to the local healthcare providers and the nurses and the medics, so they can deal with a war situation, with the influx of large trauma patients, with mass casualties, with wound care, with amputations, with infections, and all of the issues that comes with war and disasters.
We're here for the long term. We'll be here 5 years, 10 years, 20 years down the road, providing assistance as needed.
We also provide sustainable medical programs that helpful to the local community based on the priorities of the local communities.
Our speakers share their own experiences, and they even say not all of their records were documented in books, not all their recommendations. That's why it's firsthand. This is quite valuable.
They did the theoretical part well. Theoretical part and practical part. They showed many traumatic injuries that may be caused to a person. Their gunshot wound with shrapnel, large vessels, heart, lungs, stomach. That is a theory day, and today is our practice day.
There's a lot of discussion about important things like we should behave regarding medical tactics, and generally, international support is very important to us.
This course is important because foreign doctors who already had experience in previous wars shared it helped to treat better so that there were fewer complications. To make our treatment effective, it means that you have to constantly learn.
You can donate to MedGlobal at www.medglobal.org to Ukraine and other programs, and your donation will be translated into saving lives.